Hello and welcome. This is a very small video. The topic is application of IV Apresol or Hydralazine in hypertensive emergencies during dialysis or intradialytic hypertension. Definition of intradialytic hypertension. Intradialytic hypertension defined as an increase in blood pressure during or immediately after hemodialysis which result in post-dialysis hypertension has long been recognized to complicate the hemodialysis procedure, yet it is often largely ignored. Prevalence of hypertensive crisis in Indian emergencies. Around 1 to 2% of patients with hypertension develop a hypertensive crisis during their lifetime, 22 to 44 lakhs. Uncontrolled hypertension can progress a hypertensive crisis defined as a systolic blood pressure more than 180 millimeter of mercury or a diastolic blood pressure more than 120 millimeter of mercury. Chronic kidney disease and dialysis perspective in India. The number of deaths attributable to CKD in India rose from 0.59 million in 1990 to 1.18 million in 2016. Estimated number of kidney failure deaths to be 1,36,000 in 2015. In 2018, estimate put the number of patients on chronic dialysis in India at about 1,75,000, giving a prevalence of 129 per million population. About two-thirds of all patients with kidney failure died without receiving dialysis in 2010. This is the main issue, the prevalence of intradialytic hypertension in dialysis patient. Current evidence suggests that intradialytic hypertension may affect up to 15% of hemodialysis patients and exhibit independent association with future cardiovascular events and all-cause mortality. Systolic changes in intradialytic hypertension. Increase in systolic BP of more than 10 millimeter of mercury from pre to post hemodialysis or after 2 hours of dialysis when significant ultrafiltration had occurred on 3 consecutive dialysis sessions. Apresol parenteral administration. Apresol hydralazine hydrochloride 20 mg per ml in 1 ampule. The route are intramuscular, intravenous. In IV route, there are IV bolus, diluted slow IV injection, and IV infusion. IV intravenous. The goal is to reduce the blood pressure to 140 by 90 millimeter of mercury. Diastolic BP must not fall below 90 millimeter of mercury. Doses should be adjusted according to blood pressure. IV injection bolus, diluted slow IV injection, and IV infusion. Apresol 20 mg per ml ampule, 1 intravenous IV bolus. When there is urgent need, therapy in the hospitalized patient may be initiated intramuscularly or as a rapid intravenous bolus injection directly into the vein. Hydralazine hydrochloride injection should be used only when the drug cannot be given orally. The usual dose is 20 to 40 mg repeated as necessary. The IV 10 to 20 mg every 4 to 6 hours as needed may increase doses up to a maximum of 40 mg per dose if necessary. Apresol diluted slow IV injection. Dilute 1 ml, that is 20 mg, in 9 ml of 0.9% sodium chloride to obtain 10 ml of solution containing 2 mg per ml. Administer 5 mg, that is 2.5 ml of diluted solution over 2 to 4 minutes. Check the BP for 20 minutes. If BP remains uncontrolled, repeat injection. Continue repeating if necessary, waiting 20 minutes between each injection, maximum 20 mg total. Apresol IV infusion. Dilute 100 mg, that is the 5 ampule, in 500 ml of 0.9% sodium chloride or ringal lactate to obtain a solution containing 200 microgram per ml. Initial dose, that is 200 to 300 microgram per minute. Maintenance dose 50 to 150 microgram per minute. Administered by increasing rate up to 20 drops per minute, maximum 30 drops per minute. Check BP every 5 minutes. As soon as hypertension is controlled, decrease progressively the rate 15 drops per minute, then 10, then 5 until stopping infusion. An abrupt discontinuation may provoke a hypertensive crisis. Contraindication of IV Apresol. Known hypersensitivity to hydralazine or dehydralazine or to any of the excipients. Idiopathic systemic lupus erythematosus and related diseases. Severe tachycardia and heart failure with high cardiac output. Example in thyrotoxicosis. Myocardial insufficiency due to mechanical obstruction. Example in presence of aortic or mitral stenosis or constrictive pericarditis. Isolated right ventricular heart failure due to pulmonary hypertension, cor pulmonale. Dissecting aortic aneurysm, porphyria. Warnings. In a few patients, hydralazine may produce a clinical picture simulating systemic lupus erythematosus, including glomerulonephritis. In such patients, hydralazine should be discontinued unless the benefit to risk determination requires continued antihypertensive therapy with this drug. Symptoms and signs usually regress when the drug is discontinued, but residua have been detected many years later. Long-term treatment with steroid may be necessary. Incompatibilities. Dextrose infusion solution are not compatible because contact between hydralazine and glucose cause hydralazine to be rapidly broken down. Adverse reactions. Adverse reaction with hydralazine hydrochloride are usually reversible with dosage is reduced. However, in some cases, it may be necessary to discontinue the drug. That is the common adverse reactions are headache, anorexia, nausea, vomiting, diarrhea, palpitation, tachycardia, angina pectoris. The less frequent, that is the in digestive system, constipation, paralytic ileus. In case of cardiovascular, that is hypotension, paradoxical pressure response, edema. In case of respiratory, that is the dyspnea. In case of neurologic, that is the peripheral neuritis evidenced by paresthesia, numbness and tingling, dizziness, tremor, muscle cramps, psychotic reaction characterized by depression, disorientation or anxiety. Genitourinary difficulty in urination. In case of hematologic logical, that is the blood dyskaryosis consisting of reduction in hemoglobin and red cell count, leukopenia, agranulocytosis, purpura, lymphadenopathy, splenomegaly. In case of hypersensitivity reaction, that is a rash, urticaria, pruritus, fever, chills, arthalgia, eosinophilia, and rarely hepatitis. I used IV Apresol few of my patient. I am referring one example in this video. The patient is a 63 years old female patient, known case of hypertension with end-stage renal disease on maintenance hemodialysis for last 5 years, and history of intradialytic hypertension in the current episode. Uh, I used slow IV method, that is 1 ml of IV Apresol to be mixed with 9 ml of 0.9% sodium chloride, that is the total solution is 10 ml, that is injection Apresol is 2 mg per ml. During the intradialytic hypertension, in this case, the first recorded BP was 218 by 130 millimeter of mercury. After that, I I gave the I injected 2.5 ml diluted IV Apresol over 2 to 4 minutes, and I was waiting for 20 minutes. After that, I recorded the BP. By the time BP was 209 by 97 millimeter of mercury. After that, I injected 2.5 ml diluted IV Apresol for the second time, and I was waiting for the 20 minutes, and after 20 minutes I recorded the BP, and by the time BP was 176 by 84 millimeter of mercury. After that I injected 2.5 ml diluted IV Apresol over 2 to 4 minutes for the third time, and I was waiting for the 20 minutes, and after that I recorded the BP, and the recorded BP was 171 by 83 millimeter of mercury. After that, I given the 2.5 ml, that is the fourth time I injected this IV Apresol over 2 to 4 minutes, and waiting for 20 minutes and recorded the BP. After that, the final BP was 158 by 84 millimeter of mercury. So in this case, the first BP was 218 by 130 millimeter of mercury. After giving IV Apresol, that is total 80 minutes, the last BP was 158 by 84. I used this injection few of my patient, and it was successful to control the intradialytic hypertension very smoothly, and we can use it very smoothly for it's a very good choice to control the intradialytic hypertension in this. Thank you.